Right. So what we have initiated yesterday about role of a business analyst in context to the healthcare part, majorly. So major focus being a business analyst whenever we are working on healthcare, especially on facets, application will be on one is relating to the configuration part, like facets configuration is what we need to understand. So for that, the existing system should be understood. At the same time, as I told you, there are different transaction codes we use, especially for the claim processing, claim adjudication, all that. Right? So different code sets and all everything we will be using. Apart from that, we even one should know about what are the different medical plans we have, like Medicare, Medicaid. So these are the two major plans, as I stated earlier. One is about Medicare, as I told you, like it's a kind of plan majorly used for people, wherein this have again four classifications. We have four different classifications: A, B, C, and D. But whereas Medicaid, of course, that is not something. There is no classifications in Medicare. But if there is any in reference to this program of Medicare, any changes depends on the state government resolutions or decisions taken. So that changes will be adopted. So what are the different medical plans we have? Either when you see from the government perspective, Medicare and Medicaid, which will be controlled over by the CMS, which is called as Center for Medicare and Medicaid Services. And second is a private insurance players. These private insurance players, usually we classify those plans and all everything on two different areas. One is HMO and second is PPO. HMO stands for Health Maintenance Organization. Second is Preferred Provider. This thing, right? So Health Maintenance Organization is a basic premium plan because whoever wants to ensure themselves in reference to the healthcare as part of private insurances, I'm talking about, not in the context of Medicare and Medicaid. Right? In the context of private insurance, HMO and PPO. Health Maintenance Organization is a basic standard plan where people are allowed to meet the doctors which are in their respective network, because generally the network, there will be some list of network doctors are available, right? So usually this will be classified into two different parts, East and West. East network, there are some list of doctors followed by the medical practitioners and all everything list will be available. At the same time, even
sorry to cut you in between. If you are sharing your screen, I don't see it. I see only the frozen screen where you have some of the healthcare BA screenshots.
I haven't shared anything so far. I'm just explaining that.
Okay.
Because I'm going to explain about the HIPAA, then I will share the screen.
Sure. Okay.
Okay. Because this is all the basic part of it, whatever I'm discussing, right? So,
sure.
So HMO and PPO, Health Maintenance Organization is the first one. Second is PPO, which is stands for Preferred Provider Organization. HMO is a basic plan where people are allowed to meet that local clinics, right? But whereas Preferred Provider Organization, wherein allowed to meet any specialized doctors, whoever we wants to meet, so we are allowed to meet. So these are the two differences. If someone is opting for private insurance plans and all everything, these are the two basic things is required. So there are different medical plans come into picture, not only Medicare and Medicaid, especially in the context of facets I'm talking about. Because our claim management system, whatever the core administration of healthcare are we talking about, That's not only exclusive for claims, okay? Because facets application will be used, as I mentioned, even for billing and all, for subscriptions, etc. Hence, this facet application, whatever the health insurance plans, are not something uh, pre-enrolled in either Medicare and Medicaid. Even private insurance plans will also be incorporated in the facets application, which can be customized by the organizations. Depends on the organizations and all that. So whenever they want, this application is required some customization to be made. So whatever the plans are related, so those plans can be adopted. So this is where generally being a BA we have to see, because whatever the provisions, whatever the program benefits, because sometimes when you see Medicare and Medicaid, the program benefits, for example, I'll put you this way. Earlier, there was no seasonal diseases because uh, there was a program at the time of Obama. It was introduced in the year of 2010 called Obamacare. So in this Obamacare, earlier there was no seasonal diseases which were incorporated in the medical plans earlier in the beginning time. So there was nothing of that sort. So after that, whenever Obamacare 2010 came, Obamacare has given some leverages to the people who are in the low income group people. In addition to that, even seasonal diseases were also included. So the resolutions as well as the decisions of the medical plans depends on two factors. One is the government initiatives, whatever the program benefits, add-ons or whatever it was, the changes and all everything must be integrated and adopted into the facets application. This is one thing. From the private insurance company's point of view, they may come up with different insurance plans, either maybe exclusive for COVID plan, right? So post-COVID, I'm talking about. Or else there may be some different healthcare insurance plans they may be introducing exclusively for a particular problem, right? So these kind of plans, that modifications, integrations has to be made by the BA. But if you want to know about healthcare plans, all that stuff, business analysts should understand about the HIPAA rules and regulations, right? So HIPAA requirements, compliance, and all everything is what we need to know. So when we see about HIPAA, as I mentioned you earlier, Health Insurance Portability and Accountability Act, it's a kind of act which was introduced by the government, wherein this is not something confined only for the codes, whatever we use, all that. Of course, these HIPAA compliances are something useful when we are upgrading our systems or when we are maintaining the infrastructure, because any healthcare organization. Am I audible now? Am I audible now?
Yes, you are.
Yeah. So as far as HIPAA rules and regulations itself is concerned, as I mentioned, it is not only about the procedure, whatever we follow, because for every uh, classification of diseases, like what are the diseases, for every diseases and all, there will be some code number will be provided. Even for procedures, also the same. Even for claim related, claim request, even for claim scrubber, even for claim adjudication and all, different codes we use. So not only for procedure diagnosis and as well as for the claims, even HIPAA related even to the infrastructure, because normally healthcare organization application users are two. One is provider, second is a payer. Okay, these are the two people majorly. Provider means healthcare providers, I mean to say. Payers nothing but again payers we can classify into two different parts. Either these payers may be CMS people, like government entity like CMS department, or else private organizations, private insurance organizations. These are the two different people we consider as payers. So when we see these HIPAA rules and regulations, when we see about the healthcare applications to use, healthcare providers and as well as payers. Both people follow their business processes. For that, whatever the application they use, either they may be using Facets application or it may be of any other application. What infrastructure is required? So, what kind of infrastructure is needed to uh, to develop for the healthcare related process and all that? Not only for this, again, whatever the administrative activities they have to perform, at the same time, whatever the security are you going to provide? Because what kind of firewall protection are we developing for the application, for the particular application? Uh, whatever are we involving in our healthcare environment? It could be facets or something. Everything should be falls under HIPAA itself. That's the reason why TriZetto facets application, which was developed actually, it is completely based on the HIPAA standards itself. Otherwise, that product doesn't get any acceptance to use by the healthcare organizations, because this was developed somewhere in the mid 90s. It was initiated. Earlier it is called as paper claims. We used to do UC9 and all. Of course we call it as UC10, all that. So after that, the encrypted format, whatever the transactions we are doing in a code basis we are doing. So even whenever the Facets application has initiated, the Facet application development itself is based upon the HIPAA rules and regulations and all. But still there is a continuity where they have to perform self audits and all. Usually audits, as you know, will be of two different. One is internal audit as well as external audits will be there. Now, in the context of the role of a BA, when we see about as far as HIPAA itself is concerned, of course, knowledge over HIPAA is required. What are the rules and regulations and all are needed for a BA? But not only that, being a business analyst, the first thing is about audits. Whenever there is auditing required, right? So because self audits will be done by the organization by itself, which is called internal audits. Of course, external audits will be done by the people come from the HIPAA compliance people, right? Those people will come. Being a business analyst, whenever we are working as a business analyst, especially on healthcare applications, so we will be involving in self audits as well, internal audits also. This is where the role of a BA comes into picture. In addition to that, I'm discussing about the context of HIPAA, okay, not in the related other areas. So self audits, preparing self audits, where there will be an auditing team as separate, who will do the internal audits, whether are we following the right practices, standards or not. So being a business analyst, we will be involving in this. But here, normally these are all quality audits, you know it, right? So quality, whether are they following the quality control measures when they are performing the business activities and all, everything comes under the internal part. Being a business analyst, we will be focusing more on the standards what organizations are following, because some organizations use ISO, CMM level, Six Sigma, right? So different organizations, different standards they follow. I don't say every organization, but large organizations, if you see from the higher context, they will be following CMM level company and all. Then because they have to follow the CMM standards, even though they are into healthcare segment, they follow CMM level standards in their organization to manage their business activities and managing their functionalities within the organization. At the same time, they have to implement HIPAA rules and regulations within their applications, whatever it is using, because that is not something only connecting to Facets, because sometimes they have to integrate Facets with other applications also. For example, there was an application which you might be knowing is called Epic. I think you might have heard about it. Epic software. Ram.
Yes,
Yeah,
I
Epic.
do.
Right. Epic is a software. Epic usually it's a healthcare patient management system where they will take appointments and all of that. For that generally. Sometimes these Epic software means I'm talking about from the provider point of view, not from the payer point, because payer doesn't require majorly of this, but majorly used by the providers here. This Epic software integration required to integrate with Facets. That is one thing which we have to ensure of, because when we are using Facets as an application, it falls under the rules and regulations of HIPAA itself, so that we don't see any difference in it. But whenever we are integrating with Epic software, we are not sure whether is it following the right practices of HIPAA or not, right? So because even Epic software will have a customer data to be managed, right? So they create even dashboards. They see the reports of the people whoever has visited, right? So which patient, which doctor has availability at what time, which place, right? So all this can be seen in Epic. So when we are integrating these applications, whenever we are integrating, especially this Facets application with Epic and all everything, we must ensure whatever the configuration or whatever the integrations we are doing. So we have to make sure that the kind of API they use, because normally to connect and to access the information from another systems and all, usually technical people write, you know it, right? So APIs will write either maybe RESTful API or so, whatever it is and all. APIs will be written by the people so that we can extract the information from other systems and we can see, right? So this is what generally APIs integration. So while integrating API, while we are implementing API and all everything by the technical team even, they have to ensure that whatever the integrations they were doing with Epic software has to follow the HIPAA compliance standards that we have to see being a BA. So this is where, because when we talk about audits point of view, audits is not only about Facets application we are using, but we also has to see, is there any other applications which are integrating to this or not? That we have to ensure being a BA. This is where our role come into picture internally. Second is about Health Cloud. You might heard about it even, right? Health Cloud, which is part of Salesforce, because CRM applications will also be used in the healthcare environment to know about the customer perception, expectations, all that. Prominent tools are two. Prominent applications are two across industry. Three, I can say. In Indian context, we have one more, but usually across the two different ones. Of course, Oracle CRM is also there, but major is Salesforce and second is Dynamic CRM. Salesforce CRM application and Dynamic CRM application are two. And from context from the India, we have now it's now it is gaining popularity called Joho. You might have heard about it. Joho CRM is getting popularity. Oracle have CRM application as well. So Health Cloud application will be connecting with the Epic software. Usually that integrations will be taking place. So HIPAA, whatever the Facets application using by the provider, that will be integrating with HIPAA. That will be integrated with Epic software. And this Epic software will also be integrating with the Health Cloud application also, because to manage CRM processes and all everything, to extract the customer data and all, normally we extract the customer data from the Epic software, because that is the initial one where they'll be taking patient appointments and all. So Epic software is being used majorly. So extracting the Epic software where they have to incorporate with the CRM application, where Health Cloud is an application which normally we are using nowadays. So we have to ensure whether these people are following HIPAA standards or not is what we have to see. So when we talk about self audits, when we talk about internal audits point of view, we have to ensure what integrations, which applications were integrated. Are they following the right practices of HIPAA or not is what we have to see being a BA. This is point number one. And whatever the self audits, whatever the internal audits done, usually we do these audits for every 6 months, usually 6 months to 9 months, I can say. It's 6 months for every 6 to 9 months, normally these audits will be taken place. Role of a business analyst will be involved in these grounds, point number 1. Second, whatever the necessary documentation relating to that, so that also will be prepared. Because whatever the related documentation we have to prepare for HIPAA, right? So that also will be prepared by the business analyst team. So this documentation is not something I'm talking about BRDs or something like that, because those are all the documentations we'll be preparing as a part of requirements communication, I mean to say. But not only that, if HIPAA documentation, compliance related documentations means whatever the audits was performed by the internal teams and all, finally they have to prepare a documentation for that. So what are all the rules and regulations they are following, right? So what final conclusions they have made, they have to prepare their own documentations as separate. We have separate templates for that, which are available online, which are available in the organization itself. From the organization's healthcare point of view, I'm talking about. One more documentations was some other documentations are not relating to provider, because if you can pause it for provider for some time aside, healthcare means even healthcare organizations who will be like these people, like people who promote labs, all that, right? So something like Dr. Reddy's or something. So people who manufacture, right? So different medicines and all that. So they have to go for approvals. Usually those people have to go for approvals before, for example, they want to start a clinical trial for a particular this thing. For a clinical trial and all, of course, they'll be doing this clinical trials and all, everything on animals and all that, right? Usually that's all. So before they are going for clinical trials and all, they have to prepare a documentation and they have to submit it to the respective organization, government entity. So wherein they have to get an approvals from them. So that sort of documentations involvement will also be done by the BA. I don't say that we will be completely doing that complete documentation by a BA alone. I don't say that. I am talking about that context, because I am talking about people who are in the health life sciences side. I'm talking about, not in that. But to an extent possible, whatever the required information is needed and all, that required information will be provided by the PA. So provider, healthcare, hospitals, treatment for the patients. This is one category. At the same time, healthcare organizations, whoever manufacturing any vaccinations or something like, before they are going for any clinical trials or they want to get any approvals from that, whatever the necessary documentation will also be part of it. So that part, whatever the related information which is required, if there is anything from the business side to be provided, so that information will be provided by the BA. So involvement in terms of the documentation, from that context, being a BA, we will be supporting from the business point of view. Understood? Clear, Ram? Are you clear on?
Yeah, it is clear. And I think these so most of these things are self-explanatory. So I'm okay to move forward. HIPAA is fine. I know the requirement for the documentation audit and what are the places where the BA help is required. So yeah, I'm good on that. Maybe we can move forward.
So can I skip the HIPAA then?
Yes, please.
Okay, thank you. Now, do you have any idea about how this claim processing happens and all that? What are the codes we use and all that? Do you have any idea on this?
No. So this would be helpful. This would be interesting.
Right. So the claim processing, let me explain you on a high level note how this claim processing will be taken place. Usually this claim processing means once the treatment is done, right? So whenever the treatment done to a patient, usually medical coding people prepare the case, based to case, they prepare the documentation, they fill the forms. Whenever they fill the form, usually there will be 3 people, they will be involved here, right? So 3 people will be involved. So one is providers, second is payers, third is sponsors. Okay, these are the three people. We need to understand the difference between among providers, payers, and as well as sponsors. Providers nothing but healthcare provider, right? Hospitals, etc., etc. Right. So these are all the providers. Second is about payers. Payers nothing but people, insurance companies or CMS departments, right? These are the second persons. Sponsors nothing but organizations, healthcare. For example, a person working for an organization. So for their employees, organization is sponsoring. Right? Organization is sponsoring healthcare benefits and all everything for their employees. I'm talking about employer point of view, employer and all. So those are considered and comes under the sponsors. These are the three people. Now, if there is any kind of claims to be submitted initially to start with, whenever the process of treatment to be made for a person, whoever came for the treatment, the first thing what is that an organization provider has to ensure is the eligibility is what they have to see. They have to see the eligibility verification. That is the first step normally happens, because claims happens next. Right. So before you're going for claims and all everything, the first thing is about eligibility verification is the first one. So eligibility verification again depends on two areas, as I told you. So some people have Medicare plans. Again, in this Medicare, somebody may opt for plan A, somebody may opt for B or C or D. That is one category. And the second category people are Medicaid, people who are from the low income group people and all everything comes under Medicaid. So this is one area. Second area is private insurance people, because sometimes there will be eligibility verification. I'll give you a scenario where usually the major challenge, I don't say challenge, where majorly the case comes like, for example, why is an individual having a Medicare insurance plan, he has an insurance plan for himself and as well as for his family. Apart from that, generally they will be taken even private insurances also sometimes for an additional benefit and all everything. Some people do, they will be opting even for private insurance also. So whenever that kind of person, whenever has approached in hospital for the treatment for the provider, we have to see eligibility verification. We have to see on what context it has to be, because that person has an eligibility for Medicare, maybe, right? So because as he is working for the organization and all, he has that facility, right? So he can do that. But whereas in the other area, whenever you see this from the other side, person has taken a private insurance also, right? He may have taken HMO or PPO plans from the private insurance companies outside. So when we see about eligibility verification and all that, depends on the kind of treatment what is to be provided for the particular patient, right? At the same time, interest as well as the decision over the patient, whichever the insurance plan is he opted for, so that eligibility verification will be taken place. Understood? Clear? Ram?
Yeah.
You're following, right? So
Yes.
when we talk about eligibility verification, eligibility verifications and all, on if a person has a single plan, there is no point to discuss more, right? So because that particular Medicare or Medicaid plan, we see the eligibility, whether that person has an eligibility, because if it was not lapsed so far, so that treatment can be started. Sometimes a person having two different plans, depends on the kind of treatment what is to be provided. At the same time, depends on the type of plan it was, because whenever the organizations provide, you know it, I don't need to explain in detail, but usually whenever this will be provided from the organization point of view, the healthcare health insurance and all, the benefits varies, depends on the kind of band which that person belongs to, because a person whoever is in the higher level or the higher level position in the organization, whatever the benefits they will be getting is different from the person who is in the next level. There is, depends on the kind of package, depends on the kind of band they will belongs to. The benefits will vary slightly, right? So slightly vary. First point. Second point is that what organizations do, organizations will get the insurance plans which are customized. Because, for example, JED is a insurance organization. They have a customer who is a software company having somewhere around 5,000 employees. Let me put it this way, right? 5,000 employees were there. So organization want their employees to be insured. So whatever the existing plans, health insurance plans, which are available in the insurance organizations, those plans will be customized. Those plans will be customized according to the customer have an account. As of now, they have 5,000 employees, which those 5,000 employees has to be insured. So whatever the existing health insurance plans available for the private organizations, I'm talking about private insurance company, okay, not Medicare and Medicaid, right? That is standard, that never changes. So whenever the private insurance companies they opt for, these private insurance companies will have their own health insurance plans. These health insurance plans will be customized according to the requirement of the customer. This is where generally, being a business analyst, we will be involved from the provider point of view, payer point of view. For example, why is a person working as a business analyst for an insurance organization? Maybe from, for example, Cigna, right? So he's working for Cigna, right? For example, right? He's working for that organization. So responsibility of a business analyst, not only on facets application, claim processing, adjudication, apart from all that. So being a business analyst, our role is more important to customize the applications. Because if you remember, whenever I have explained yesterday, even I have repeated today, right? Healthcare plans, analysis and all, everything will be done. If there is any changes, that will be upgraded to the facets, right? That's what I said. In addition to that, if there is any customer come across for that insurance payer, right? Payer, any IT company having a size of 5,000 employees to be insured, the customization plans and all everything, that requirements will be gathered by the BA, right? This is where, being a business analyst, we will be involving. So, because most of the people will have a confusion over, because Raj, as I am a business analyst in healthcare environment, where my job opportunities are, of course, you know it, but on a general note, I'm saying, because people will have a confusion over, because roles and responsibilities and whatever the activities we will be performing, being a BA, will slightly vary. If you are working from the provider point of view, the responsibilities of a BA is different. Wherein if you are working from the payer point of view, whatever the activities and roles and responsibilities being a BA we will be performing will be different. Those are two differences, right? That we have to see. From the payer point of view, requirements gathering, wherein understanding the requirements of the customer, based on the customizing the plans, is what generally, being a BA, you have to do. Is it clear to you, Ram? Understood?
Yes.
Clear out, right? So this is what it
Yeah,
is.
it's clear.
So in this grounds, usually being a BA, we will be working. This is nothing to do with facets initially to start with. Okay, facets comes next. So before that, when there is a customer, according to the customer, customization plans will be prepared. So for that, initial requirements will be taken. So that healthcare plans analysis will be done by the team, by the business analyst, and rest of planning of the plans and all, everything will be done by the subsequently by the other SMA people and all, right? So that's what it is. Now, whenever coming back to the provider point of view, eligibility verification, whatever the eligibility verification inquiry will be made by the provider to the insurance payer, comes under 270. 270 is a code which normally we use, form, I can say. 270 is a code or a form, which is part of eligibility inquiry. So whoever wants to do any kind of eligibility inquiry and all, everything, whether the person has having a valid insurance or not, right? So easy enrolled or not, to see it. Whatever the inquiry we do, that form and the code, whatever we use, is called 270. These we call it as EDIs. EDI stands for Electronic Data Interchanges, which has encrypted codes. 270 is what generally the code we use initially. So once the inquiry was made by the provider to the payer, against to that we get the response. The